good morning, everyone. My name is Kathy Allard. I'm career advisor here at Flathead Valley Community College, and we are going to be talking about physical therapist assistants today. And we've got a terrific panel, and we have some attendees here from local high schools. Thank you so much for taking the time. We're really glad that you're here. If you have questions throughout this, feel free to put them in the Q&A, and we'll address them towards the end. But we definitely want to take your questions if you have any. And so, first of all, we have Janice Hiles. She's the PT program director, the physical therapist assistant program director. Courtney Harmon, who is currently a student in the program, and Justin Stevens, who graduated last year in the physical therapist assistant program. So can you each, starting with Janice and then Courtney and Justin, share maybe about 30 seconds or so about what it is you do and what you like about the field? Well, maybe that'll take longer than 30.
Janice. Yeah, happy to. Well, I am the PTA program director. I am a physical therapist. I transitioned to this job from working in the acute care field for 20 some years. And before that, I was working as a traveling physical therapist. And before that, I was working as a outpatient and rehab therapist. So I've been a therapist since 1992. And I guess what now I'm currently do is this job. And then I also work PRN, which means on an as needed basis to keep my hands in the field currently as an educator. So that's kind of what brought me to this position.
Awesome. Thank you. And Courtney.
Yeah, my name is Courtney Harmon. I am a student in Janice's program this year. I always knew that I wanted to do something in healthcare. And a few years ago, I observed with a physical therapist. And the first day that I observed with her, I just fell in love with the profession. And so now I'm here in the program. And I'm really excited to finish the program and graduate and start working as a PTA. So.
Terrific. Thank you. Justin, last but not least.
So Justin Stevens, I kind of grew up and injured myself a lot. So I was in PT myself throughout the years, and that kind of stoked the fire for me to be interested in the field. I worked in an outdoor industry for a long time, and then I was looking for something a little more steady year-round employment, and FECC has a great 2-year program. And it's a small class, so you really get hands-on and the people there really care about you. So it was a really appealing, and plus I lived here in the Valley, so that was also appealing. So then I graduated last year, and now I work in the private practice outpatient industry here in the Valley, and it's fantastic. The people that I work with are great, and the Valley is obviously beautiful.
Well, and I guess we should back up a little bit. And what is a physical therapist assistant, Janice? What is it?
Yeah.
What do they do?
Well, it is just in its title, they assist the physical therapist. And as Justin said, it's a 2-year program. The physical therapist program is a doctorate level program. So that takes about 7 to 8 years. And so this has been a profession for over 50 years. We just had our 50th birthday. And so I came upon as just an extension of the physical therapist because of the shortage that occurred at that time. So what they are able to do is they implement all of the same interventions that a physical therapist does, except they do not evaluate. And they also cannot work without a physical therapist being part of the plan of care. So they need each other. They're a team, and the physical therapist assistant, from a stereotype standpoint, gets to do maybe more of the fun and interventions and less paperwork. That's one of in certain places, that's kind of how it works. But yeah, there's team matchups that work a little differently in each different clinic in terms of how the model works with the PT-PTA, but essentially it is a team that's meant to work together, and they need each other. The PTA needs a PT to be the initial evaluation, and then continue to be an integral part of that plan of care.
Well, thank you. I appreciate hearing the whole scope of what you do. And Courtney, I have a question. I'm curious, you said you're a current student. Is this something you always knew you wanted to do, or did you find your way to it in a winding path? Or tell me about that.
Yeah, no, I never, like I said, kind of in high school, I thought that I might want to do something in the healthcare profession or in the healthcare field. But after high school, I moved up here to Montana and I worked at a hospital for about 2 years. And I just worked as a dietary aide. But I decided that I wanted to do something else. I wanted to go on to school. I just wasn't sure what that was, what I wanted to do yet. And so I met with with the chief nursing officer at the hospital that I worked at. And she got me an opportunity to observe with one of the physical therapists there. And, I just immediately found that that was what I wanted to do. And so I continued doing my prerequisite classes and then applied to the program. So.
Well, terrific. Thank you for sharing a little bit about your path here.
Yeah.
Well, and Justin, you mentioned a little bit about, being here and loving outside and that sort of thing. But can you possibly share what is one of the coolest things about your job? Or was there a specific even, I don't know, day that was outstanding, or what's something you really love?
So the real deal about being a PTA is just being able to help people live a more mobile life. And so I like the outdoors, just like everybody, pretty much everybody that lives in the valley. We like to go do all the things, and sometimes we get banged up, and those seem a lot more challenging. So being able to help people get back outside, or even just be a little more mobile around the house, depending on where they fit in their scope or their journey in life, just being able to help people enjoy life is the main reason I like doing this job. The job is so much fun. Like every day is different. Like every patient is different, even if they have the same ailment or problem. People differ from patient to patient, and it's just so much fun. It's dynamic, and you always get to think critically about not hurting that person. So it's a lot of fun. So much fun.
So to follow up with that, then what sort of skill sets or personality do you need to be successful in this field?
Okay, to speak to that, I think coming out of high school with minimal experience, it's just nice to be able to have a mindset of caring about others just as much or even a little bit more than yourself to be a really effective any kind of healthcare worker. But I feel like that might be one of the bigger components, is just really having empathy for people and where they're at, and seeing where you can kind of join them in their walk and how you can benefit them. Like you have to add value to their life, or else why would they pay you to do anything, I guess.
So, and I imagine that looks different for every patient, as you say, trying to meet them where they are and where they are in their healing. So Janice, can you share what you think might be good qualities for someone who's in this field?
Yeah, no, I have a lot of, well, first of all, we get information from our whole community on what the actual businesses and practices feel would be a good candidate for their working in their businesses. And one of the biggest things that they always speak of is just a love for people and a good communicator. So those skills can go in many different fields, but specifically in the field of physical therapy, you are such an integral part of their, as Justin said, getting back to something that they are looking to do, or recovering from a certain injury that is taking them out of their normal life, whether it be work, whether it be an activity, whether it be a sport. So you get them at this very vulnerable point, and you want to make sure that you have a healthy respect for that role that you have with that patient, ethically, personally, positively. So I think it's really important to be very positive and optimistic, but also be very knowledgeable about what the patient needs to do to get them independent. So a big part of our role is not just to get people dependent on physical therapy, but get them to develop skills and habits that are going to lessen their need for physical therapy in the future and get them, to do certain exercises or certain movements different than maybe they have when we are establishing habits. So I think knowledge, positivity, good communication, personality skills, and then just the sheer amount of critical thinking is really important. This is not, no patient looks the same, just as Justin said. One person will have a completely different path oftentimes by just a certain movement that is different. And so you have to be able to assess that and observe that in the moment and be able to make different changes based on that and be very flexible for knowing that it may not look the same. And so what we tell the students often is that this is not a black and white type of profession. If you like rules and you like things to be the same response every single time, it will be a frustrating field. There's lots of gray. So those are just a few things that come off the top of my head.
Yeah, it's almost like you need to be a detective when you're working with people and figuring out the clues and the things that they're sharing.
Exactly.
Working
Yeah.
with your physical therapist and figure that out. So where might a person typically work who's doing this job?
Well, that's what's great about it, is there's lots of options. So again, when I was a traveling physical therapist, I was exposed to home health settings, outpatient settings, both private practice and hospital-based, working in a hospital-based acute care, working a hospital rehab, which is recovering folks from, trauma or a stroke, a head injury, that kind of thing. Skilled nursing facilities, long-term care facilities, school systems, working with children in the school system, but also there are specialty clinics. There are pools. Aquatic therapy is another element to it. Athletic centers, you can be part of that. There are even some chiropractor offices that have physical therapists working with them as well. So those there's a lot of variety in actual settings. And then there's also a lot of variety in ages, working from babies up to geriatrics.
And so I'm thinking this is something that you need to continue learning. You need to continue learning new processes and updates. And is it a continual learning field? Justin, You're nodding your head.
Mm-hmm.
Totally, every day.
Mhm.
You're gonna, it would be very important for a person going into this field to always want to continue learning, to be a better PTA or PT, just to always want to be better, to always look for the best research, to who's writing the research and validate it, and just always being adamant about being better every day and learning from what yesterday brought us.
Mm-hmm.
Awesome. Well, and Courtney, it makes me wonder, since you're still in the program, what are you finding is the most energizing part of it? And what do you find the most challenging, if I can put you on the spot?
Yeah, I guess probably the most energizing part might just be getting to work so closely with all of my fellow classmates. Right now we only have 10, or actually we only have 9 classmates, 9 students in the program. And so we're very close. We spend a lot of time together. And another thing is just, I love learning new things. I've always loved education. In high school, I loved taking as many classes as I could to try and learn new things. And in this program, we're just constantly learning new things. It's kind of a fast-paced program, but for people who are really interested in the content that we're learning about, it's a really great thing.
You need to be really solid in your anatomy and physiology. Is that what I'm hearing? Okay.
Yeah, yeah, there's a lot of anatomy and physiology. There are 2 anatomy and physiology classes we have to take before even getting into the program. And then we take an anatomy and kinesiology class, which kinesiology is the study of movement. So lots of anatomy, because you have to understand how the body works and the different parts of the body in order to treat people. So definitely a lot of anatomy, lots of content to learn about.
So is that part of the fun and part of the challenge?
Yeah, part of both, definitely. It is somewhat challenging because there is a lot of information. And like I said, it is pretty fast paced. You have to have pretty good study skills. If you're just trying to learn things so that you can pass a quiz or pass a test, it's not going to work well for you because everything you're learning is something that you're going to be using for the rest of your career. So you need to have good study skills, and you need to be pretty hardworking to be able to get through the program.
Okay. Well, thank you for letting me put you on the spot about that. And so, Justin, I'm curious if you could share what a typical day looks like for you, if such a thing exists. Typical.
So like I said, I'm an outpatient. It's a private practice, so people come into our office. That fits my personality. I knew early on I didn't want to work in inpatient or acute care or travel. I wanted to work for a nice local office. So my day is, well, it's kind of different. So I run a wellness program as well in the mornings for one of the local lumber companies, making sure their employees stay in shape because they have a very stressful job. But in the office, I see a range of patients from stroke patients to, like yesterday, I had 3 rotator cuff repair patients. So they all looked a little different, but they all had just had their shoulders put back together. So that was fun. So it's just, you go in, you work with your staff. And so finding a staff that you really enjoy hanging out with, it's the same thing as your classmates. You're going to spend a lot of time with them. You're going to be talking to them a lot. You're going to grow with them as a team. So I found a really nice office that I'm stoked to work for. And our patient list varies drastically. Sometimes I see people inpatient or in home. We have a couple of people that we have in home that I drive out to and see just because of COVID, really. But some people aren't very comfortable coming into the office right now, which is understandable. So we're kind of meeting them where they're at, which is another dynamic of this profession. You just want to stay flexible because it's going to change. It could be just the disease process of a patient could change, or it could be the office where you need to go in home to see somebody because of a certain thing happened. So.
And Kathy, if I can speak to that, because I'm PRN and working in a different field than Justin, it is oftentimes when you go in, you have your selection of charts and list of patients. And so typically the routine will be looking at those charts on the computer. Obviously, everything is electronic medical records. So you go in, you check, kind of see their status. And then prior to seeing each patient, you're talking with the team, sometimes having rounds where you're working with, the nurse, the doctor, the occupational therapist, the speech therapist, the dietitian, the pharmacist. So working as a collective team, and then prior to going to actually physically see the person, that environment is different than where Justin's is. He has like a 9 o'clock appointment or a 10:30 appointment, whereas in the inpatient setting, oftentimes you're just seeing people when they're ready. And so checking in with the nurse to see if that was a good time to see that patient, and then implementing your treatment, and then doing your charting after is kind of and I would say, and I'm sure Justin and Courtney can attest to that, your day just goes by very fast. Like it's just very, it starts with the friendly faces of your team, and then ends very quickly to go home to your other team.
Well, terrific. Thank you for sharing a different perspective on that, Janice. And I guess, Justin, you brought something up, and Courtney as well, about working closely with people, and that some people are not wanting to come into the office right now. So you're being flexible. So how, Janice, are students learning together? How are, during the time of COVID?
Oh yeah, well, we've had some different models, truthfully. Justin's class, we got kind of just slammed into it really abruptly. And so abruptly went into online lecturing, and then had very small groups where they would come in and we would wear PPE, which the personal protective equipment, to implement the hands-on techniques. Because as they've noted, this is a very hands-on field. You can learn all in the book, but unless you feel a rotator cuff and palpate the muscles that are involved and move the body part around, it really is a hard thing as a student to implement those skills. So Justin's class had a very different experience. And then when we learned more about COVID and we learned about certain strategies that we could take to protect people, then Courtney's class has been a little bit different. We are, during our lectures, socially distanced, everybody's masked, we're doing all the hand washing. And then when we implement our hands-on skills, we wear more personal protective equipment. So I would say we're fairly lucky in that in the realm of having a hands-on field, we've been able to integrate our skills with personal protective equipment and just being thoughtful about what are risky skills and what are not, and minimizing those and minimizing the contact of people and partners. I mean, a big part of our philosophy is you should work with lots of different people. And in the realm of COVID, we've had to rein that in a little bit more. So I would say that, I'm hoping as the months go on that becomes a little bit less likely of a barrier for our students, because of the skills that carries into the real world is you need to see one patient and then do something different with another person and et cetera. And when we're not able to do that's a skill that's probably a little harder to learn, that flexibility that's really relevant for the job.
Mm-hmm. So, but throughout this, you've been able to maintain your program. Thank you for sharing how you were able to do that.
Yeah.
Perfect.
Yep.
So I guess I'm curious then, what would you recommend people look for in training, or whether they go to college or wherever for this training? What would you recommend that they look for? And I throw that out to anybody.
Well, looking for training, I guess when you're looking for a PT or a PTA program, you're really looking for what fits your study habits. What's your learning style? So we always ask that in the interview. We say, what is your learning style? And some people learn independently, some people learn in groups, some people learn via the computer. Everybody has a visual, auditory, or hands-on type of learning skill. So I would say that our program specifically is definitely a more small group, hands-on, a multidisciplinary part of learning style. So I would say you're going to want to ask questions about how does the flow work for your learning style. You also want to look at their outcomes. You want to see how Justin is at the point where he's going to have to do his national licensing exam, which is integral for both PTs and PTAs to take a national licensing exam, which is your ticket to your job. So even if you graduated from a program and did not get that license, you would not be able to work as a PTA. So a big part of our strategy with our students is preparing them to effectively pass that test. So you're going to want to look at what a program PT or PTA's licensing exam rates are. And then you also want to look at what is their success in getting jobs. And so ultimately, we keep track of what our graduates are doing and what we can do better to prepare them for different fields. And so you want to know that you have from a program a support system to do that. And so Kathy, you're part of that as well. When people get ready for their graduation, that we not only prepare them from a knowledge base, but we try to prepare them for the professional part of getting a job. So that's an important part of a program. Also, making sure that, we have a unique situation that when I started this program 9 years ago, the same two people are a part of the program. So we've been able to keep consistent faculty. So making sure that, you're getting a approach from not just educators, but also educators that are drawing upon real true clinicians. So that was one of the drawbacks of COVID too, is we were not able to do as much with our community, which is such a big part of our valley here. So we're hoping that that's going to be a little bit more normal as well. So looking at what a program has for different ideas coming in and making sure that they're of best evidence, best practice, and then making sure that that they have good relationships with those instructors and peers. Like we have a small group, we have 12 or less. Some programs have 20, 30, 40, 100 students. So what meets your learning style is going to be another thing that you're going to look for.
Okay, well, thank you. I appreciate your sharing that, Janice. And we have about 4 minutes left. So let's see if any students have questions. If students do have questions, just put them in the Q&A and I'll read them to the panelists. If you don't, that's fine, but this is a great time to get those out there.
Ask your questions.
Okay, what is the difference between a physical therapist assistant and a physical therapist?
Well, I mentioned that one of the big parts are education. So a physical therapist at this point is a doctorate level program. So you would need a 4-year degree on top of an additional 3 to 4 years. So there is that's a big difference, a doctorate level versus an associate of science level, where a PTA has a minimum of a 2-year degree. Most students, I would say, have a little bit more than that in terms of education. Many have bachelor's degrees coming in to get this 2-year degree, but at the same time, that's not a mandatory part of the degree. So it's comparing a doctorate level degree with an associate's level degree. And then the skill set that is the biggest difference is the evaluation component is solely up to the physical therapist, who develops a plan of care for the physical therapist assistants to implement. So they can do the same interventions, they can do the same exercises, they do the same manual techniques, with the exception of manipulation, dry needling, and evaluation. Those are the big skill differences.
Thank you. Well, and there's another question that popped up, and maybe we'll start with Justin on that one. Then if there's time, Courtney, and we'll finish up for today. But Justin, someone asked, why did you choose PTA instead of PT?
So you guys have heard Janice say there's 7 to 8 years versus 2 years. That's the main thing. So I was a little older in my life. I've worked in the outdoor industry. And so the 2-year program fit my lifestyle and what I knew I was capable of. I didn't want to go back to school for 7 years. That is the sole reason I chose PTA. Plus, you really don't do, like Janice said, you really don't do less. You don't have to do as much paperwork. You don't evaluate and you don't stab people with needles. Like you get to do all the other fun stuff. Like you get to help them work out, you help them rehab from whatever injury you're going into. So you get the best of working with people. If that's what you're really passionate about, is working with people, you get to work with them. There's only a couple of differences, and those differences didn't change my mind. It really actually helped my mind and solidified 2 years is way better than 7 for me, only for me.
Well, thank you for sharing that. And so it sounds like it's really relationship based and working with each individual. So Courtney, can you finish us up here in the next minute with why you chose PTA?
Yeah, I mean, Justin pretty much just said it. The schooling as well as what PTAs can and can't do. There is the stereotype, like Janice said, of PTAs or PTs having a lot more paperwork to do because they can do evaluations. And I didn't really want to do that as much. Before applying to the program, I worked at the hospital as an inpatient therapy aide. And so I got to see some therapists would have a few different evals, and their total patient load might be 8 to 10 people, while the PTAs only saw existing patients and they could see up to like 12 people in the day, which to some people might sound like a lot of work, but to others, it sounds like an opportunity to see 12 different people and, make a difference in 12 different people's progress in their physical therapy journey. And so I think that is a big part of why I chose PTA instead of PT.
Well, and thank you for the questions. We appreciate those. And Courtney, thank you so much for your time. And Justin and Janice, It's been a pleasure having you all talking about the physical therapist assistant world. So with that, it's time for us to close out, but if people have follow-up questions, they should get in touch with a program near them. Take
Thank
care.
you.
Thank you.